Starting the bulletin with big news coming in and what all parents have also been asking for and expecting. India is now all set to ramp up its vaccination drive with the third wave that continues to grip the countrymen. Dr. N.K. Arora, who's the chairperson of the COVID-19 working group of the NTAGI, has said to India today that India may begin inoculating children in the age group of 12 to 14 years against COVID-19, and that vaccination will possibly begin in the month of March, which is 2 months away. Remember, with 15 to 18 population of the group is likely to then get fully vaccinated by the month of March. So what are the statistics right now? Over 3.5 crore children, what we are being told, between the 15 to 18 age group have already received the first dose of COVID-19 vaccine since 3rd Jan or since it began. And therefore, once that is concluded, we can have it for 12 to 14 years of age as well. Apart from Delhi, it was the financial city of Mumbai that was also reporting high numbers, and now what we are picking up is that Mumbai also is reporting a decline in its daily COVID numbers. 7,985 people tested positive for the coronavirus. 11 deaths also with regard to COVID-19 and comorbidities have been reported in 24 hours. So there are still a death count that is emerging from the COVID-19 pandemic. The current positivity rate in Mumbai has been recorded at about 14%. You can see the graph on your screen. The numbers and the spike appears to have come down, but that should not mean we should give down our guard. The Maharashtra Health Minister Rajesh Tope has hinted that schools may be reopened in Mumbai in the next 10 to 15 days if the numbers continue to come down. Look at constantly these graphics that we have prepared for you to help you understand the graph which saw a massive spike in Mumbai and then is witnessing a slow and a gradual downward trend. From 16,420, that was a spike. It did come down to 13,000, 11,000 and now 10,000 in the city of Mumbai. But is this a peak that is now coming down, or is it perhaps some sort of now a static approach that is also being taken in Mumbai, which has also seen at some level restrictions taking place? But again, even in Mumbai, while deaths are being reported, hospitalizations like the Delta wave are still comparatively less. Remember, however, there's been constant question that has emerged both in Delhi and Mumbai. There have been residents who have rushed with home testing kits. And therefore, the authorities would want to take those results also in consideration, because what if people are testing positive with the home testing kits and are not informing authorities? Mumbai has tried to ensure to include the home testing results as well. Saurabh Vakhtania is now joining me from Mumbai. Let me quickly go across to him. So Saurabh, of course, good news that numbers are coming down. What could possibly be the reasons? And for Mumbai viewers who are watching right now, can we expect then schools to reopen and perhaps some curbs to ease in Mumbai if the numbers continue to come down? Saurabh.
So Pooja, first of all, the BMC officials are telling that for one more week they will be monitoring the situation. Yes, the curve has flattened and the cases are coming down in the last few days. But what they are saying is that over lakhs of home testing kits already went through the distributors to the chemist and to the people of Mumbai. Now what they are saying is over lakhs of testing have been already done, but those tallies have not been up to the official tally. They are saying that after testing at home, people are not reporting to the ICMR or putting it at online. So now what the BMC officials have made mandatory, Pooja, that when you buy a home testing kit from a chemist, you have to give your Aadhaar card as well. So your information, your address and as well as your phone number. So that complete detail is taken by the chemist. The chemist then gives this particular figure to the BMC officials in the evening. So this is the new process which is now started by the BMC officials. This has started 2 days back. But yes, good thing is that over 55,000 tests per day, and now we are reporting less than 10,000 numbers, which were already earlier around 20,000, 21,000 per day. The biggest concern right now is, Pooja, not just for Mumbai but for Maharashtra. Maharashtra still is reporting over 42,000 to 45,000 cases. and Mumbai, Pooja, 11 deaths per day.
Yes.
So that
is why it is important that, yes, while we welcome the downward trend, but we ensure that it remains down and that we are taking all precautions. Saurabh is telling us home testing kits need Aadhaar cards, and the individual taking the kit will have to get back with whatever is the result to the nearby pharmacist, and we can hope that perhaps that is also being followed. Thank you so much, Saurabh Vakhtania from Mumbai, updating us with the latest. But of course, with the question of low testing or testing that is becoming a problem. Amid the surge in COVID cases in Delhi, several testing centers are denying collecting samples of patients, citing new ICMR guidelines. Many people in the national capital are therefore facing a problem because of the revised ICMR guidelines. My colleague Milan Sharma tried to dig deep, speak to people who wanted the tests to be done. What was the reason they were being denied? In this special report, take a look.
Rahul wants to appear for a Coast Guard recruitment exam. He has to submit his COVID negative report before 19th January so that he is counted as eligible. But Delhi's testing centers are refusing to test.
Still, मेरे को submit करना होगा. I think maybe मेरे को report चाहिए था, whether I am positive or not. So I am looking for my report.
Patient की demand पर test नहीं होगा. आप डॉक्टर से लिखवा के लेके आइए.
Okay. If I don't have any such kind of money, so I can. If I go any private institute, so they will charge me about 800. So why I can pay that much amount? So what if I am asymptomatic then?
Asymptomatic patient का test नहीं होगा.
Okay.
वेबसाइट पे गाइडलाइंस है.
Okay.
तो आप पढ़ सकते हैं.
Okay.
और न्यूज़ चैनल्स पे भी आ रहा है.
So I think तो मेरे को तो डिसअपॉइंट होकर जाना पड़ रहा है क्योंकि मेरे को 19th को तो मैं कैसे रिस्क ले सकता हूँ इसके लिए. तो मे बी शायद दे विल नॉट अलाउ मी टू एंटर इन दैट एग्जामिनेशन. सो दिस इज वेरी डिसअपॉइंटिंग फॉर मी.
This bank employee needs a test certificate to go back to office. He too is denied the test.
Actually, I'm working in banking sector. I was getting some इस तरह के conditions थे. मुझे लगा कि मैंने अपने आप को isolate कर लिया था. बैंक वालों ने भी बोला कि आपको without report we can't give you permission to enter into the organization. ये हमारे एक family doctor है, ठीक है, who is working with ये आम आदमी मोहल्ला क्लिनिक. इनके अंदर में 3-4 मतलब हैं मोहल्ला क्लिनिक्स. तो he also prescribed. अब इस चीज़ को इन प्रिस्क्रिप्शन ले या ना ले, ये देख लीजिए, इन्होंने प्रिस्क्राइब करा था.
An elderly man came to test having ended his 7-day home isolation. He too is kept waiting.
Actually, 7 days ago I came here and I got test positive. Now, since the 7 days period has completed and I have to go to the work and I have to sit with my family also, till that time I was a home quarantine. Now I'm asking ki do my test and let me know whether I became negative or not. No. They said ki no, we will not do that.
Testing centers don't have enough testing kits, and that is the problem. This gentleman had to go to several places before he came here, and even here at J Block Saket they have said that testing will not happen because there are only 70 kits. Testing is being curtailed, but people are being inconvenienced, and that is the major issue in a city like Delhi where cases are surging and the peak has still not come in the third wave.
We asked the employees at the Saket testing center why they are refusing to test.
मैम हम यही कह रहे हैं कि जो सिम्टम्स वाले पेशेंट हैं उन्हीं का कर रहे हैं. आयुष्मान की गाइडलाइन सही है और 60 प्लस अबव का उनका टेस्ट हो रहा है. हाँ, 60 से कम है उनका नहीं होगा.
हाईली
सिम्टोमेटिक का होगा.
जिसको सिम्टोमेटिक है जो वो होगा.
अच्छा, और उनके लिए वो डॉक्टर से प्रिस्क्राइब करके लिखवा सकते हैं. ऐसा नहीं है कि टेस्ट नहीं होगा. वो मैम ऑफिस वालों का है और डोमेस्टिक एयरलाइंस के लिए नहीं है.
Even those who have to travel abroad are being told not to test. Some succeed after much coaxing.
They are just telling me that I don't need a test.
Okay.
They're only testing symptomatic.
Okay.
I'm traveling in a couple of days and I was faint positive last week, so I did a couple of rapid tests. It came negative, but I want to be sure with the RT-PCR.
Okay. Many centers are running short of testing kits. This man and his wife have visited many testing centers of Delhi, but will go back today without any success. They are told only 70 kits are being given to this center per day.
You want to be sure. I have throat infection. I don't want to risk it. So yeah. So me, my wife, both we wanted to get it tested rather than staying in ambiguity. So we can stay at home, take medicine. That's the other way around. But then might as well get it tested is also important.
टेस्टिंग किट मतलब वही 100-150 के आसपास ही आती है हमारे पास. अब 70 के अराउंड आती हैं. अब हमें मॉर्निंग आने के लिए बोलते हैं क्योंकि नेक्स्ट डे आइए, मॉर्निंग में आइए. अब जो हमें सामान मिलता है हम तो वही करेंगे ना, हम एक्स्ट्रा कहाँ से कर पाएंगे.
The new ICMR guidelines have created a lot of confusion. District authorities say they are only following the rule book.
लेटेस्ट ICMR गाइडलाइंस के अनुसार सिर्फ सिम्टोमेटिक जो लोग हैं जिनको फीवर, कफ या ऐसे कोई कोविड के सिम्टम्स हैं वो टेस्ट किए जाएंगे. जो इंटरनेशनल ट्रैवलर्स हैं, चाहे वो आ रहे हैं या जा रहे हैं, उनको टेस्ट किया जाएगा. या फिर जो हाई रिस्क कॉन्टैक्ट्स हैं कंफर्म्ड पॉजिटिव केसेस के, वो टेस्ट किए जाएंगे. तो अब दिल्ली में हम पर्टिकुलरली इन्हीं कैटेगरीज को टेस्ट करेंगे.
Most people coming to various centers in Delhi are not being allowed to test now for such reasons, citing the ICMR guidelines that say you don't need to test after 7 days. But the problem is that whether it's work establishments or whether it is certain establishments that are asking for a COVID negative report will not take people back to work also if you don't have this report. And this is why people in Delhi are being inconvenienced at the moment. With Pawan Kumar in New Delhi, Milan Sharma for India Today.
And now to our special story of the day. Look at this visual on your screen. This is about how COVID-19 is impacting us all. That's a 1-month-old infant baby boy who has been detected with COVID-19, with the coronavirus. Of course, in the arms of the nurse supervising this baby's recovery. As per the doctors at the Moolchand Hospital, where this baby boy was undergoing treatment, the baby was brought with increased irritability, fever, was not accepting milk feed, and that is when the parents of the child rushed him to the doctors. On examination, COVID was detected, treatment was provided, and the good news is that the baby has been discharged. He's back with his parents in 4 days' time that he was there at the NICU at Moolchand Hospital in Delhi. But why we are showing this to you is a reminder that children as young as 1 month old are being infected in the corona pandemic, even with the Omicron wave. And the one who was supervising this child is Dr. Preeti Chadha. She's a consultant pediatrician and is also with the neonatal department at the Moolchand Hospital in Delhi. Dr. Preeti Chadha, thank you for speaking to me about this very important and crucial story. My first question will be, because this is a 1-month-old baby boy infected, were there specific symptoms? How did the doctor suspect that this could be a case of COVID-19? Do tell us about this case that came to you.
See, this was the 1-month-old baby which delivered under my care only. I was seeing this baby since baby was a newborn. I was doing the follow-up. Before few days, the parents called me that baby is very irritable. He's crying very much. So I called them for a checkup. That time baby was fine. But after 2 days, again father complained he is not taking feed, better to see the baby again. That time I found baby was having running fever and baby was very irritable and he is having ear discharge. That's why we suggested to admit the baby for antibiotic for the ear discharge, because he was very irritable and not looking in a quite good state of health. As an admission policy, we did the rapid antigen test, which came positive. That's why that was an incidental finding along with the ear infection. Okay. So we were planning to admit the baby for the ear infection, and the COVID. He was tested for the COVID also.
So doctor, if you can confirm to me, for how many days was this infant baby boy in the Moolchand Hospital in Delhi?
Baby was admitted in Moolchand COVID isolated NICU, because just 1-month-old baby, so we kept baby in an NICU. So baby was with us for 4 days. We gave IV antibiotic. Baby responded to antibiotics. His ear discharge, his pain, fever was decreased, and baby remained stable in the nursery. We did a close monitoring like oxygen level and all this, but baby remained stable. So we planned discharge after fourth day, after the coverage completion of fourth day of antibiotic, which baby was without fever for 3 days and was taking feed properly. Then we planned for a discharge to the baby. So baby was with us for 4 days.
Well, there's a positive news of a kind that we would like, that the baby is discharged and back home. But the doctor, has there been a rise in infant or toddler cases or hospitalization that the doctors of pediatric age group are witnessing in this wave? And please do tell us then, what do young parents, what do they need to know regarding children with COVID that is also spreading around us?
See, we have seen infection in a pediatric, like babies or toddlers, in last wave also.
Yes.
Yes, of course. In this wave, we are seeing more number of cases as the infection rate is high. That's why we are seeing more number of cases in pediatrics also. So, and my advice for the parents is that just no need to panic and just observe their baby. If they feel there is a, if baby is taking feed properly, doing urine properly, and is baby is active, no need to worry, no need to do panic at all. We have seen the newborn babies, like 15-20 days old babies also with positive infection.
Okay.
But they all are managed at home. Okay. No need of hospitalization or anything.
All right. So not very severe cases, but there are cases being reported and being hospitalized. Now, I'm also a young parent, Dr. Preeti. I also have an infant baby at home, so I can also connect with the concern and fear of many today. Do you think that it is also important for parents to know that we do not let our guard down, thinking it's a mild variant, it's not leading to a lot of hospitalization? Do you again give that recommendation that we do not let our guard down around children even now? Because specifically this age group is unvaccinated even now.
Yes. Children are not vaccinated and their immunity is also very underdeveloped. Yes. So we need to be very careful along with the children. Parents, if they are going outside, so let's keep their guards up only. The masking and social distancing is must. This precaution which we are following in COVID, this is the universal precaution which we take care for the babies. That is pre-pandemic era also, we were using the same precaution for the babies. So that is the only advice. No overcrowding, no exposure in a crowd. You please put up their guards and do the maintain social distancing.
Dr. Preeti Chadha, thank you so much for your advice and for taking care of these little babies and ensuring they recover well and head back to their home with their parents. Thank you so much for the work that our healthcare workers have been doing for now more than 2 years. That was Dr. Preeti, 1-month-old baby who has been infected with COVID-19. There were symptoms as well, but is now, of course, headed back home.